oftentimes there's this disconnect between what the community wants and needs and what our policymakers push in terms of policies, in terms of bills, in terms of legislation. And we need to connect those two to make sure that youth have what they need and that communities in general have what they need. So it's really important for them to have those conversations, not to just base it on religious beliefs or beliefs about whatever one thinks of as their own moral compass, but to make sure that those beliefs or those bills and laws are based in facts and scientific evidence and in a way that gives more latitude to communities, but also make sure that people really have information.
When you look at legislation, there are so many people who could tell stories about the impact of teen pregnancy or sexually transmitted diseases having on their neighborhoods and on their communities. And these are folks who have become real advocates for better sex ed and better health policies.
When we do our work with adults to help the young people in their communities, they're building up the next generation of Mississippians that can move our state forward.
I think in Mississippi we've had a history where information has not been free and readily available to all communities. And that's really unfortunate because when you have communities that aren't given all the information they need to be successful, they're going to make decisions that are not in their best interest. We feel that by having those conversations, having those trainings, having those opportunities where we're challenging perspectives, but also offering a new way of thinking about things, offering, again, that scientific information, that evidence-based information, giving people all the options, then they're able to make better decisions for themselves. And what better decisions look like are not only in the best interest of youth, but for the adults who hear that information and for generations to come.